everyone, and welcome to Rad Chat, the first therapeutic radiographer-led oncology podcast. So welcome to number 49. My name's Jo McNamara, and I'm joined by fellow host Naman Jolka Anderson.
Hi everyone.
So a huge thank you to our last guest, Pete from Mummy Star Charity, who discussed his career, his experiences of being a bystander to cancer, and how he used his grief to help start the charity Mummy Star. If you haven't had a chance, please do go and take a listen. So I'm so excited to introduce our guest for this evening, Zoe Merchant, who is discussing her career today, prehabilitation, rehabilitation, and her leadership in developing and implementing services. So hi Zoe, welcome.
Hi, nice to be here. Thank you very much for having me on the programme.
Oh, absolutely. I've been wanting to have you on for ages, so it's so exciting. And thank you for clearing your very, very busy schedule to come and join us. And Zoe, I believe you've got to get home quite quickly, so you can't be too long on the podcast.
Yeah. I was just saying before we started that my husband is he's a researcher in proton beam therapy, and they can only do their research overnight because the beam's normally being used for patients at the Christie during the day. So I've got to get home so I can let him go off and be a god of science working on the beam overnight doing research.
I love it. I love it. So yeah, this will be a nice average timed podcast episode, so everyone can relieve a sigh of relief. Although Zoe, you'll have to keep us to time because we do talk for ages.
I'm a talker, so it'll be you'll have to keep me to time. Just think of the beam. Think of me getting him to the beam, okay?
Absolutely. So Zoe, do you want to start by telling people that don't know who you are and what your job title is, what your role is, and your professional background?
Yeah, absolutely. So I am Zoe Merchant. So I think the reason I've obviously been asked to come on this podcast is because I've been involved in the kind of delivery design of the Prehab for Cancer and Recovery programme in Greater Manchester, which I'm going to talk a bit more about in a little while. So I was the programme lead for that when we first started during transformation and for the first few years, and I'm now the allied health professional lead for the Prehab for Cancer and Recovery programme. So I've kind of got several jobs. So that's one thing I'm doing. I'm also currently working as a program manager for the Lung Health Checks program in Greater Manchester. So doing that as a secondment, which has been very interesting and really really insightful in terms of thinking about how we try and screen people for lung cancer and try and diagnose people earlier, which is really good. And then I'm also doing a part-time PhD.
As you do, when you've got two jobs.
Yeah, and two small children and a husband who needs to go to the beam at night. So I'm also doing a part-time PhD with the University of Manchester, which is all around digital technology, wearables, so commercial wearables, and within cancer pathways to see kind of the experience of patients and healthcare professionals about how you could use wearables within cancer pathways. So my background is I'm an occupational therapist. So I will do the blurb about what an occupational therapist is, because even though you should all know already, let's face it, most people will not know what it is. So for those that don't, occupational therapy is all about how you support people to live their lives despite illness and disability and disease. So it's all about thinking about how people function in their daily lives. And it's not just physical focused, it's physical health and mental health. So it's understanding that if somebody's been diagnosed with cancer, or if somebody's got a disability, or they've had a stroke, how they are living their lives in and around that condition. And it considers all different forms of occupation. So by occupation, what that means is anything that's a meaningful activity to somebody. So that can be from just the basics of getting up in the morning, having your breakfast, having a wash, having a shower, all the way through to your work, looking after children, social life, so it encompasses everything really. So I've been an OT for quite a while, and my kind of clinical background was really working in rehabilitation, So for many, many years, I did neurological rehabilitation. So working with people who had any kind of, so whether that was brain cancer, whether that was a stroke, whether that was Parkinson's or multiple sclerosis, or motor neuron disease. So working with people to rehabilitate them to in terms of thinking about how they were coping with their everyday life and getting back to doing all the things they wanted to be doing despite having you know having had some kind of brain injury of some sort. So that's like my main background from a clinical perspective, and that's kind of what led me into doing prehab and rehab, which is what we're going to be talking about, I think, today.
You sound very busy. What's a normal day like for you? Like,
Well, a normal day is a busy day. So in terms of the targeted lung health checks program, a lot of that is just kind of managing the service, kind of thinking about how we continue to develop the service, making sure that we're getting patients to come along, and that we were sending out invitations, but we're getting a really good uptake for that. And then it's working with NHS England and with our local kind of commissioners and healthcare management system in Greater Manchester to think about how we can roll it out for more people. And working with clinicians and working with doctors and nurses and all the other people involved. So that's what I'm kind of doing a lot of day-to-day stuff. In terms of prehab, as the AHP clinical lead, and also as in terms of kind of supporting that program, like for example, I met up with the our program manager this morning, Kirsty Rollinson Groves, who works for the leisure industry in Greater Manchester. So she works for GM Active, which is the publicly owned kind of leisure organisations. And so we have a catch up regularly, and so I was just talking through the fact we've got loads of referrals for patients, which is really great, but it's how we manage that as a team. And because the thing is with prehab, it's not something where you could have a waiting list for patients. If somebody's referred into the service, they need to be contacted within a day or two, and then they need to be coming to the gym locally to where they live, and then assessed and given a prescription of what they need to be doing in advance of their surgery or their other cancer treatment. So we were just talking through how to manage that, and just the development of the service, because we've got constantly evolving as a service, so talking about all of that, which was really good. And then it often involves meeting with other people involved in prehab for cancer. So we've got our clinical lead, who's Dr. John Moore, who's an anaesthetist by background. So I'll meet with him, and we have lots of development meetings, but then also having conversations nationally, because we're quite a tight-knit prehab family. So there's some brilliant colleagues all over the country who are really enthusiastic about trying to make prehab more widely available for lots of patients. So we'll meet with people like June Davis from Macmillan, or all the favourite people across the country who are working on prehab, which is really nice. And then as well as that is trying to fit the PhD in at the same time, basically. And my lit report is due in 2 weeks, and I'm panicking because I've just been on an Easter break. So anyway,
and obviously all the emails, just sorting all the emails out.
Yes. Yeah, constant emails. That's just how it goes, isn't it? And Twitter, of course,
yes,
as well.
Absolutely. If you don't have time for the social media, you're not doing anything. If you don't post about it, Zoe.
Exactly. Palpitations if you've not been on Twitter for a few days. Absolutely.
So Zoe, can I take us back just a little step? Can you just tell us what is prehabilitation and rehabilitation? It's terminology that we're hearing more and more now, which is fantastic. But what actually is it?
Right. Okay. So if we think about prehabilitation, we often use an analogy, which I think is really helpful for this. So if you were going to run a marathon, you wouldn't do it without any training. And so what we often talk about is cancer treatment, and going through a cancer pathway for somebody who's newly diagnosed as being really similar to running a marathon in terms of it, in terms of the stresses that are being put on your body, both mentally, physically. It's probably going to be the most stressful thing that someone would ever go through. And so what you need to do really is to support somebody to prepare for that. And so that a whole ethos of prehabilitation is how you try and optimize somebody to really help them to be as fit as they possibly can be, as mentally prepared as they can be as they're going into their cancer treatment, with the understanding that if you do that, then they're likely to have a much better outcome from their cancer treatment in terms of their prognosis and their survival, how well the treatment goes, but also in terms of their recovery. So if people go through prehab, they're less likely to need as long in hospital, and they're more likely to be able to go back to very quickly to doing the things that they were doing before they got their cancer diagnosis. Whereas if you've not done any kind of preparation, and if almost deteriorated a little bit before you've gone into your cancer treatment, then that you're potentially at risk of needing longer in hospital. You might experience some level of complications as you go through your surgery or your radiotherapy or your chemotherapy, and then it's also then thinking about your level of functional ability once you've gone through your treatment or during your treatment. So with prehab, it's what's called multimodal. So it's not just one thing. It's not just about getting someone physically fit. Normally, when we think about prehab, we're thinking about three aspects. So there's the physical side, so kind of physically trying to improve someone in terms of their exercise levels, their fitness, their muscle strength. There's the nutritional side, so it's understanding that if someone's got a poor nutritional status, or if their weight, they're losing weight, or that there's problems in terms of nutrition. We know from the research and scientific research that people are not going to do as well as they go through cancer treatment. And then the third really key factor is the mental well-being. So it's understanding just that, psychological onslaught of having a cancer diagnosis and going through treatment. So it's how you kind of support someone to be, prepared from a well-being perspective as well. I mean, there are other aspects of prehab which people don't focus on as much, but are really important. So, for example, smoking cessation, trying to support people to stop smoking in advance of treatment, and then alcohol as well. Not a less popular topic in terms of prehab, but still very important. So it's understanding that, if you can try and help people to reduce the amount of alcohol intake they have as they go into their treatment, that they'll potentially again do a lot better. So the idea is that you, in whatever time you've got before someone starts their treatment, if it's surgery or if it's chemotherapy or radiotherapy, it might be during that period as well, that you really, have a very intensive period of exercise, nutritional assessment and support, and well-being support. And it really varies. And I think the thing we all know about cancer pathways is they're very complex and they change for individual people. So what we sometimes talk about is how you might have a diagnosis of cancer, you might have a period and then you might have surgery or something, but then there might be another period and then you might have chemotherapy. So we know that there's lots of different types of treatment. So when we talk about prehab, it can be quite fluid because you could actually be prehabbing for another round of treatment, having already had some. So that's something to bear in mind. I think rehabilitation is probably better known and better understood, but the idea about rehabilitation is just about how after somebody's had a diagnosis or somebody's had treatment, what you can do to support somebody to recover better, and to resume their daily living. So it's normally quite goal focused. So thinking about, is it that somebody wants to get back to work? Is it that they used to be able to walk to the shops every day and at the moment they can barely walk out of the house? What is it that somebody needs to be able to manage their daily living and get back to doing the things that they want to be doing? So that's where rehab really comes in. But yeah, so hopefully that's a good description. But if there's anything else you want to ask me, then please do.
No, that was brilliant. It's a nice way to split it up, I think, in kind of priorities. For the mental health side of things, what sort of things is there? I mean, there's counselling, etc., but how do you prepare someone for different stages, especially if they're going to have, let's say, surgery, chemo, radiotherapy, and potentially further treatment?
Yeah. So I think mental health is a really difficult one. And I know that when you speak to a lot of patients, they say it's kind of, in fact, it's often listed as being a problem for anyone who's going through cancer pathway. Understandably, you hear the word cancer straight away, your mind just completely goes. And actually, we've got a lot of patient groups within Greater Manchester, and they always list their priorities, and psychological support's always in the top three, because it is, people really say that they really struggle from a psychological perspective. So I think the understanding around this mental well-being bit is that, again, if you can stop somebody, if you can try and head it off the path and really support someone from a psychological perspective very early on, then the chances of somebody having exacerbated anxiety or having quite severe depression is less. So it's that idea that of course you're going to experience some level of emotional distress going through a cancer pathway, and we're not going to pretend that you're not. But actually, if you feel empowered and you feel supported and you feel that you've got um, lots of means to kind of support you through that, then you're going to have a better experience. So often when we talk about the aims of prehab, obviously there's the very clinical medical aims of trying to optimize someone, from the medical perspective, but actually in thinking about someone's experience of their cancer pathway, actually I think just having engaging in prehab can really be supportive from a mental health perspective. So some of the aspects with our service that I think really help is that there's a lot of peer support. So people they do a lot of exercise with other people going through cancer, and that might be somebody who's at the same stage of them or somebody after treatment. And so there's a lot of reassurance and what we call in the business normalization. So it's that that panic stations and the real worry and fear. It's how you can kind of see, well, Mrs. Jones has been through surgery and she's doing really well, so that's really helpful. But also, as an occupational therapist, I'm always going to say this, but just engaging in those really positive activities like doing exercise. I mean, anyone who does exercise, that you get the endorphins running, and it can really help you to feel calm. It can help you to feel a completely different outlook on the situation. So actually, even just engaging in exercise, I think, is really helpful from a mental health perspective. Um, of course, there are patients who we recognise have a harder time when it comes to mental health in terms of experiencing anxiety, experiencing depression. So some of it's about coping strategies, about anxiety management. And then we do have the option to refer patients to a variety of different services. So you may not have heard of IAPT services. So in every area of the country, you've got improving access to psychological therapies, which works alongside GPs and primary care. So in Greater Manchester, if we've got patients coming through who we think really need more support, we'll speak to the cancer nurse specialists who are often really able to provide a lot of support. But then we'll also talk to them about whether or not they want to self-refer to have psychological therapies like cognitive behavioural therapy and other types of therapy and support. And then again, it's working with medical teams, doctors. We've got a really brilliant oncology psychologist called Pod involved in our service, who's helped us design it, and he does. It's brilliant. He does every couple of months meets with our team to support them. So they have a reflective session where they talk about what they're doing and how you're working with patients with cancer every day, and it can be very upsetting and distressing. And so he works with them. So if there's specific patients who are particularly having any kind of difficulties, then we'll have a conversation with him about that, and then he's able to give some really good advice about what we need to do. So there's lots of different ways of trying to support people from a mental well-being perspective.
Zoe, how do you engage the patient in almost taking some autonomy around their own health? Because part of self-management in prehabilitation and rehabilitation is really important. Can you talk us through that a little bit more?
Yeah, absolutely. So I mean, I haven't talked a lot about our service. So we are very lucky in Greater Manchester. We were given funding to be able to create a service that's across the whole of Greater Manchester. So for people that don't know, we're like a mini London, basically. You've got 10 boroughs, all the people from down south. Manchester, what's that? So it's like a mini London. Basically, you've got 10 different boroughs. We've got 10 really big hospitals, and we were given money to be able to provide the service for patients from across the whole of Manchester. So it's not just one area, it's across the whole of Greater Manchester. So if you've got cancer of specific types, so lung, colorectal or esophagogastric cancer, and you live in Greater Manchester, then you should be able to be referred into the programme. And a really key point around that was thinking about how people could engage in exercise. So we worked with all the leisure organisations across the whole of Greater Manchester to design and deliver the service. And we've got access to about 90 gyms, like 90 leisure centres that we deliver the service out of. So a key thing is the fact that actually people are referred into the service, and then they go along to their local gym that's normally, down the road, maybe a mile or whatever. And it's really easy to get to. Mrs. Smith from down the road goes there, Fred from across the road's there. It's a very normal thing. It's not going into a scary hospital for another, procedure. It's something that's very normal. Going to the leisure centre, most people feel comfortable with that to some extent. And as well as them people engaging the programme and being told very clearly about what they need to be doing, they also have free gym membership for whilst they're in the programme. So they can, to some extent, it's trying to encourage them to be independent exercisers, so that it's about going along themselves independently if appropriate. So what we do is we do a lot of assessments to begin with, and one of the assessments we do is called the self-efficacy scale for exercise. And so for those of you that aren't au fait with the term self-efficacy, that's all about confidence. So the confidence to be able to do something, and a lot of it's to do with people's values about themselves, etc. So it's recognizing that you can't just say, right, come on now, come on the bike, let's get you exercising. For not everyone's going to feel confident to do that. So we start by doing that assessment, and that helps us to understand, how confident people are feeling, what barriers they might have to engaging. And straight away we can do what's called action planning with them. So we can really try and work through, well, what's going to be a problem for them? How can we make sure that they can overcome that to engage in the programme? And then it really is then just about building confidence. And the prehab phase before someone's treatment is very intense, and it's very prescriptive because we've got a very short period to try and optimise someone. But the rehab phase is much more personalised. So it's much more about what kind of exercise do you want to do? Do you want to do line dancing? Do you want to swim? Do you want to go walking? Do you want to run? All the different activities available in the local leisure centres or in the local area. And the good thing is that all the people that work in the team, in the Prehab for Cancer team, they're really knowledgeable about what's available locally. So it's not just about come to the gym and get on a bike and do, some hard work on a bike, which is what the prehab is often like. It's much more about, right, we're helping you to recover, but we really want to support you to continue to exercise and continue to do healthy lifestyle afterwards. And so I think that really helps people in terms of empowerment and self-management. That we do also, the pandemic's really forced us to do this. So we've got a lot of other resources. So we've got home exercise packs, which we send out to people, which has got pictures and instructions about how to do stuff. We've got YouTube videos that we've created at different levels that people can watch at home. We've got a website which has got lots of resources on. We use digital resources. So, for example, we use what's called My Zone heart rate monitors, and they're really good for people who are not very confident about exercising, because they tell you a different colour based on how hard you're working when you're doing your exercise. So if you're in the red zone, you're going really fast. If you're in the green zone, you're not working hard enough. And so we use digital resources like that to support people to kind of be able to do it for themselves as well. And I think whenever we've done any kind of planning around the service and talking to other patients about what's good about it, actually the whole idea of people feeling empowered and feeling like they can actually have some control, because often patients who are going through cancer pathways feel that their control, they lose a sense of control, that they're very much being done to, they're on a conveyor belt, and then they drop off that conveyor belt when they leave hospital. So I think the brilliant thing about prehab and rehab is that it really does give people the opportunity to take control for themselves. So often a lot of patients will come along. We did put a buddy system in place so people could bring family members, but actually I think a lot of people choose to come by themselves independently, and it's like they can be their normal selves, just popping down to the gym as opposed to being the cancer patient. So I think there's a lot of opportunity for people to feel empowered and to self-manage through prehab and rehab programs.
It's something that Joe and I keep banging on about on the podcast is, yes, they're individuals first. The cancer is something that's happened afterwards. Not everyone deals with pediatrics or teenagers, young adults, but everyone's had a life up to the point that they come in to have treatment. But yeah.
Absolutely. Yeah, absolutely. I think we're very patient-centered in our service. I think it's difficult with prehab because obviously it's being seen as the equivalent to chemotherapy. It's like it's another treatment, and that's a good thing, because actually I think we've been able to demonstrate in our evaluation how impactful it can be and how important it is and how much it can really make a difference for people as they go through cancer. However, I think it's important that you don't lose sight of the person in all of that. And really, I think it's all wrapped up together. It's a very holistic approach. It's not just, all right, if someone does a whole ton of exercise, that's going to be great and that's the solution. Because actually, if that person is really struggling from a mental health perspective, or they don't feel confident to come and do the exercise, or they stop doing it in the moment that they've had their surgery because they didn't really enjoy it and they didn't really understand why they were doing it, then that's not really the right approach. So yeah, absolutely.
So Zoe, you talked about the second London. So I live in the proper London. How do I get access to all these things?
I've been there.
So further down south, you're very far up north. So
I trained to be an OT in London, so I can legitimately talk about that London.
So yeah, proper London where we are. How do we access these things?
So the brilliant thing is that prehab is just exploding. So across the country, lots and lots of people are very key. So many healthcare professionals can really see the benefits of doing this, and lots of patients as well. And so there's more and more services coming online. In London, I know lots of colleagues who are doing brilliant work trying to get it off the ground in the Marsden. Lots of different areas. A lot of the cancer alliances. So I don't know how familiar people are, but every region of the country's got a cancer alliance, which is connected with NHS England. And most of the cancer alliances across the country are looking at how they can try and get prehab up and running. So if you're a healthcare professional and you want to know about prehab services locally, then it's really good to link in with your local cancer alliance and colleagues there to understand. You may be aware of other things going on, but they should really know if there is anything happening around prehab. There's lots of resources online as well. So for example, I'm gonna plug the Prehab for Cancer website. So we've deliberately made that so that although it is aimed at people who are engaging in our service, there's lots of patients in Greater Manchester who can't currently access our service because they're not eligible. And we were also aware that nationally there's kind of a gap. So we've got lots of resources. We've got all our YouTube videos, like I said, which at different levels. So you can be somebody who's never exercised before, or you can somebody who's quite fit already. So we've got all of those. I did some work with CRUK, so there's a really good CRUK site dedicated to prehabilitation with lots of videos, and it's quite low level because it's kind of universal. It's aimed at anyone, so you could go on there and really bearing in mind people's different lives, different potential illnesses, conditions, complexities. The key thing to do really is to talk to healthcare professionals that you're involved with, because it might be that you've got other things going on. You might have diabetes, or you might have previously had a stroke, you might have COPD. All of these conditions could impact on your ability to engage in prehab and rehab. So the first and foremost thing I would always say is if you've got a healthcare professional involved in your cancer, whether that's a doctor, a nurse, an allied health professional, a physio, an OT, a dietitian, a radiographer, GPs, have a conversation with them. They may not know the answers because, obviously there's a lot of information that they do know, but at least you start the conversation going. And even if it's just that you found resources online that tells you what you could be doing, but you're not really sure whether you should be doing it, then have a conversation with your healthcare professionals, because all healthcare professionals, they just want to support their patients. That's why they're there. That's why they signed up to do the job. So definitely speak to them. And then there's lots of other resources. Macmillan have got some brilliant resources. So you've got the Macmillan Prehab Guidance document, which myself and John from Manchester and lots of other colleagues nationally were involved in writing. And then just recently, Macmillan have also done some work around education. So there's the Prosper guidance, which I think Joe was involved in, which is all about yeah, I was going to say just a little bit. So I'm sure you might have talked about it already, Joe, but Prosper, for those of you who aren't aware, is an educational tool that people can access, which is all about how you design and deliver prehab and rehab and personalised care services for cancer patients. So it's got lots of case studies. It's got Prehab for Cancer as one of the case studies, but lots of examples nationally, because I think the key thing to recognise is that one size does not fit all within this space. And so actually, what we're doing in Greater Manchester really works for our area, but it wouldn't necessarily work in rural Lake District or Scotland or Cornwall, because it relies on the fact that people can access leisure centres really close to them. And we've got that network, and we've got a lot of qualified cancer rehab instructors working across Greater Manchester that we've done a lot of upskilling with. So it's kind of, I think there are lots of aspects of our service that could be replicated elsewhere, but then equally, I think there's lots of other really good examples. Like, for example, there's a lot of allied health professional led services, like at Aintree, Claire Knowles, the physio there. You've got Prepwell in the northeast. You've got, Active Against Cancer in Harrogate. In Southampton, there's a lot of brilliant work going on that Sandy Jack and her team are leading on. So there's lots of really good examples of different types of prehab and rehab services for cancer patients. So I think, just being aware, trying to find out what's available for you, but then being aware there is a lot online as well. And worst case scenario, if there isn't something accessible to you locally, I would really recommend just popping down to your local leisure centre and just saying, is there anybody here who's cancer rehab qualified? And sometimes there might be some funds, you might have to pay for that a small amount, or you might be able to speak to your GP about being referred onto an exercise scheme. It's not a fully fledged prehab scheme, but that at the end of the day, it's about how people are supported to try and optimize themselves in the run up to treatment. So there are lots of options, but hopefully the prehab movement is going to get bigger and bigger, the revolution. And so I'm hoping in the next few years that it'll be something that's much more universally available across the whole of the UK and indeed the world, because we're working with lots of colleagues internationally as well about trying to replicate prehab and rehab across the world. So
Well,
world domination.
absolutely.
That's what it's all about.
And I'm really excited because I've got 35 brand new healthcare professionals starting on Monday my new MSc Prehabilitation and Rehabilitation module, which is really exciting that the accreditation is now there, and education, so that people who actually have a lot of the knowledge and skills but don't necessarily have the qualifications are able to now access them. I think that's really important as well. It's not necessarily that they don't know, but having that accreditation is really important, isn't it? Zoe, I was going to ask a little bit about, obviously you touched on it, about health inequalities and, some of the eligibility. Often when you talk about prehabilitation and rehabilitation, there is this just perception, and you kind of discussed it a little bit around exercise, that you have to be able-bodied and already quite physically well to be able to undertake it. Can you kind of go through maybe dispelling some of those myths?
Yeah, absolutely. So really, with our service, we've got such a wide variety of people that access it. We've got people in their 80s, people in their 90s. And in terms of the level of ability, we do a lot of assessments to try and understand that early on. So if we do the clinical frailty score to understand people's frailty, we do walk tests and sit to stand tests. And we have a real variety of patients coming through. So we'll have people who've previously been really active and run and done this and done that. And for them, it's really important that you try and maintain that, or because there's a real risk of them deteriorating, deconditioning. But then we'll equally have people who've never been to a gym or never been to a leisure centre, or may have exercised previously in their life but haven't done it for years. To give an example, we had a lady who was a heavy smoker, hadn't done any exercise for 20 odd years, had a lung operation where she had literally her entire lung removed, and then she was fitter after that operation, coming back to the gym, than she'd been before we started. So I think it is definitely about dispelling the myth. I think what we tend to do is it's very personalized to the individual. So for some people, it might just be that prehab's just about everyday active physical activity. So it might be just about doing that extra walk every day down to the local shops, or it might be about climbing the stairs up and down a few times, or it might be about getting up and down from your chair a few times. It's all relative to you. It's all about increasing your level of physical activity rather than suddenly having to be able to run a marathon at the end of it, as it were. And there's very few people that we would say wouldn't be able to access prehab. We've got people who attend who are in wheelchairs. I think this is something that's really important to discuss with healthcare professionals as well as patients. And one of the difficulties we do sometimes have is that when people get diagnosed with cancer, the instinct from their family members and friends is to kind of wrap them in cotton wool, put them on the sofa, hand them cups of tea, which is the complete opposite of what they should be doing. And so, yeah, actually, it's very, very rare. There's only the occasional people that we aren't able to accept into service. It tends to be because they've got other things going on, like, for example, potential cardiac problems, or they might be might have an aneurysm, or there's a lot of other things that we've got to consider, because we have to be safe in our delivery of this. But for those patients, it's not that they couldn't engage in prehab, they just might need to do it in a more controlled clinical setting. So it might be that that's where it would be very helpful to have an exercise physiologist or a physiotherapist present, to have doctors nearby. It's that understanding that if you are going to do exercise, that you're really doing it within safe limits. And certainly with the pandemic, what we found is that as we're all aware, a lot of people have become very deconditioned. So actually people's balance, their mobility, a lot of that is actually much worse than it used to be. And from a mental health as well perspective, people are less confident, people more anxious. And so it's kind of bearing all that in mind, but we're still able to engage people, and we've still got huge numbers of people. We see over 1,000 patients a year coming through our service. So it's a really, really big service. We've got lots of people accessing it, and we're talking about the majority of them in their 60s, 70s, 80s, 90s. So this is not a young person's game. It's not a gym bunnies game. This is definitely about your normal person diagnosed with cancer. How can we support them to have the absolute best outcomes, to feel like they've got some control, to have a better experience as they go through it, and then come out the other side and actually be much healthier than they might have been otherwise. So it's quite odd, because we get a lot of patients who say, I'm the fittest I've ever been. like they've just been diagnosed with cancer and they're just about to have cancer surgery, and they're there, just absolutely gobsmacked at how fit they are and how good they feel. I think it's really key to focus on that as well.
It's interesting you said that. I think Stephen Tower, when he came on, so they're looking at linear accelerators that are seated as opposed to lying down for treatment. He said that actually the common misconception, or whatever, the way people view cancer patients is they should be lying down, not doing much, looking unwell. But that's an amazing thing, impact wise, for patients to be like, oh, I feel amazing and I'm going through cancer treatment. You don't always get to see it. A charity I do a lot of work for, the Move charity, so they're 5k away, the running stuff, even though most of them walk, just the community element. They say, well, I finished treatment last week, but I'm able to walk a 5k. It's amazing. And it's funny you said about being deconditioned because of the pandemic. I had a patient today saying she went out for dinner last night with friends and she's just tired from that, just because she's just not used to leaving the house. Yeah. It's weird how that kind of affects patients, or just anyone really at the moment.
Absolutely. So we've got 5k Your Way in Manchester again. And we've got Tony Collier, who's one of our user involvement reps. He's brilliant. He's very supportive of the programme and gives us a lot of feedback and really helps us in terms of thinking about it from a patient's perspective. But I go along and do the Cancer 5k with him, and it's really nice, because actually, unfortunately, there isn't an end point with our rehab phase. So being very linked into all the Cancer 5k Your Ways, some of the patients, what they tend to do is that they then join that, and they'll be going to that every month, and then starting to do park runs, and it's the community feeling, and it's that normalization again. It's for anyone going along to a park run, it's a positive thing, regardless of whether you've got a condition or an illness, and it just makes you feel very positive and like you can actually take control. So absolutely, I noticed your hoodie, Noman. It's really cool. I've not got a hoodie yet. I want a hoodie.
We all want a hoodie. We all want a hoodie.
Yeah. It's all about the hoodie.
It's a good colour as well.
Yeah, it is.
So for us, I think in any healthcare practitioners, language is always a bit of a barrier. I know, God, I wanted to ask you about barriers for setting up a service. I'm sure there's people listening thinking, prehab's amazing, we should be doing this. How do we go about it? But do you find that with different leisure centres and different cohorts of patients from diverse backgrounds, has language ever been a problem?
So obviously the same. If you're talking about just generally English as a first language and thinking about it from that perspective, in Greater Manchester we've got lots of different first languages spoken, and we are able to use interpreters, and we are able to just the same as you would, because we are an NHS service, so we're currently funded by the NHS to deliver our service. So we do that. We were very sensitive to thinking about the different needs of different people from different cultures, and also thinking about people in terms of their sexuality as well. But again, working with the leisure industry and the leisure organisations, they're really well versed in this. This is something that they think about every day, because at the end of the day, they serve their local communities. And so, although it's something that we've been needing to think about in terms of how you design a prehab and a rehab service, working with them is just really refreshing because they have a lot of the answers already. That they are really aware of their local communities. And the great thing is that although we do some specific sessions and groups that are kind of around prehab for cancer, the patients are able to access other groups and other sessions that are going on. So we've got lady only sessions, you've got specific times of the gyms which are only, one sex can go in. The you know And then people can, in terms of what they have to wear, that's all very much considered as well. And so yeah, so that's been very helpful. And I think where we struggle a little bit sometimes is about some of the resources we have, and making them available in other languages. And again, some of that just comes down to NHS resource and finances and what funding we've got to be able to make things accessible as we can. But it's something we're always aware that we need to do more on. We've recently done our evaluation, and it was brilliant in terms of demonstrating the outcomes. So we've absolutely shown that people who come through the service spend less time in hospital, they get fitter. We've even shown an association with people who've been through our service being more likely to be alive at 1 year than if you haven't done prehab and rehab. So it really can definitely shown, independently, an evaluation that shows how good it is. But one of the recommendations was that we should think more about the different ethnicities of patients coming through, and that kind of understanding the indices of multiple deprivation, and trying to get a handle in terms of the data that we collect, being able to analyse the different types of people accessing the service and how we can try and improve access for everybody. And I think that goes across the board for all NHS services. It's certainly something I think and talk a lot about related to lung health checks as well, and lung cancer screening. So yeah, it's really important.
So Zoe, just thinking about kind of your experiences and evaluating impact and things, I know from conversations that I've had and some of the research and work that I'm involved in that some healthcare practitioners will think that rehabilitation, prehabilitation maybe isn't part of their role, or that actually the public health messages aren't necessarily about their role. What would you maybe say to a healthcare professional who might say, oh, that's not for me to worry about, I'm going to refer to a physio straight away? What would you suggest?
Yeah. Well, I think sometimes that goes back to, again, people's knowledge and their confidence about this. It's something you don't want to give the wrong advice. And again, I think a lot of this often comes from the right place. Also, healthcare professionals are notoriously overstretched. So I think it's that thing, well, if you don't really know about something, then hand it over to somebody else. Actually, one of the key things we did in the delivery and the design of the service was a lot of education with all the healthcare professionals, because we're reliant on referrals coming from 10 different hospitals, and within those hospitals lots of different clinical teams. So we did a lot of education days, upskilling, and trying to share ultimately everyone wants their patients to do well. And so if you can really explain and educate people about why it's so important to advocate prehab, and how it's going to make such a difference, straight away people get it. Um, One of the things that a lot of the patients said to us in the early days when we were getting feedback about the service was actually they really needed to hear about the service from their oncologist or their surgeon, which makes me sad as an OT and an allied health professional. But I think it's understandable, if you just had a diagnosis of cancer, that person you're looking to give you the advice at that time is the surgeon or the oncologist who's going to do your treatment. And so we worked really closely with those clinical groups. Um, the other thing is again, there's some brilliant resources. So it's not Public Health England anymore, but there's a free physical activity champion training you can do that you can access. A colleague in London called Sarah, who works at the Marsden, she's she's the oversees the physical activity training, and what that's aimed at is any healthcare professionals doing very short, an hour session about how you can try and feel more confident to work with someone around physical activity, whether it's a really quick conversation with a patient or whether it's something bigger than that. Also, there's the Moving Medicine website. So I don't know if you're aware of that, but again, that was very mainly sports exercise medicine led. So I've got a brilliant colleague called John Rogers, and there's Rebecca Robinson based in Sheffield, who were involved in that. And if you go on there, that talks to you about how you can spend 1 minute, 5 minutes, or 10 minutes talking to a patient and trying to introduce the concept of exercise and some of the, the healthy lifestyle interventions that we've discussed with a patient. So I think it's the same as anything. You need to understand where that person's coming from, and what's the kind of hook that's going to make them want to do this. And I think it's also about again, I think there's that myth that there's this group of people over here who the specialists who are going to do all this work. Well, they don't exist often. There are some brilliant specialists working in oncology, physios, OTs, and others, but often it is about what we refer to as generalists. So general people working, whether they're healthcare professionals, nurses, allied health professionals. If you're working with a patient, it's understanding what their needs are and how you address those needs. And often I find that a lot of the needs that people have as they go through their cancer pathway that are kind of beyond their medical treatment and some of those things, symptoms, etc. A lot of the time, prehab and rehab really can be part of that solution to addressing people's needs. So I think it's really working closely and very much I think the interprofessional working. So I think one thing I'm really very want to advocate is how much knowledge exercise professionals have within the leisure industry, because a lot of them have worked in falls prevention, cardiac rehab, pulmonary rehab. They've worked with lots of different types of patients. They've got a lot of experience. And then the ones that have gone on to do cancer rehabilitation qualifications, they're really knowledgeable. So I think it's feeling confident to work with those colleagues because, at the end of the day, before I came into this role, I was confident about doing rehab with people. But when it comes to exercise prescription, what would I know about that? I wasn't a competent person in terms of talking to somebody about exercise, or I didn't feel like I was. So I think it's about trusting the colleagues that have that knowledge, and then really working well as a team, but very much with the patient at the centre of that team.
I think people forget, though, any conversation you have with a patient is going to contribute in some positive way. If you're telling them, try and take the stairs today, that's going to help them. Even if they don't do it this week, they do it in a month's time, you have helped them in some way. I think the confidence in something Joe and I have come across, so just the podcast and probably just working anyway in general, that as healthcare practitioners, if we're, for example, in radiotherapy on the treatment floor, you have 10 minutes per patient, whatever, you don't necessarily feel you have the time to be able to do it, but it's really important. And it could be exactly as you said, that if you like walking every now and then, that's enough, that's your niche, that will help that patient, it's fine, I think. So I think we could talk on for hours, but I'm very aware we want to make sure your husband can go and use the proton beams properly.
Yeah, I was just conscious of the time.
So we always like to end with some top tips. You've said some amazing things throughout, and I've been being kicked by Joe to remember to keep talking, so I've just been fascinated by everything you've said so far. But a few top tips for anyone listening, whether they're patients, healthcare professionals, or just general public.
So I think it's about understanding what your level is and not feeling overfaced by the idea that if someone's going to say you need to be doing exercise or thinking about your nutrition or well-being before treatment, that means you've got to do something radical. It's about doing that within your comfort zone, but getting the support you need. I think one thing I would really like to say is that I think cancer's a scary word. I think people don't like talking about it. And I think, it's really important to think about your networks. So, friends and family, when someone gets a cancer diagnosis, they don't know what to do. They don't know how to help. So if it's just a case of saying, I need to start doing some exercise, will you come with me and do a walk around the park? And an opportunity to have a conversation about what's going on, or not just have a normal conversation. I think that's really important. There's a lot of research out there. I mean, I haven't really talked about it today, but there's on Joe's course there's a lot of research available around prehab, and it's a really growing emerging field in terms of the evidence base. So there's a lot of different papers you can look at. If you start with the Macmillan prehab guidance, there's some really good references in that, but that's a few years old now. So again, looking at a lot of the references out there. We wrote a implementation paper. So if you kind of want to know more about prehab for cancer and what we've done locally, you can have a read of that, or go to our website, which hopefully explains a bit more. But yeah, I think it's just really thinking about the positive. I mean, cancer can be very difficult, and I'm not trying to downplay it at all, but there can be a lot of positives. And I feel like, it's been such a privilege to be involved in developing this service. I know 3,000 patients in Greater Manchester have had a better cancer experience than they would have had we not put this service together and got it off the ground. And so I think it's about that, really focusing on the positives, but then being very personalised and focused on individuals within that.
Oh, amazing, Zoe. Honestly, so much information. We'll definitely link all the resources that you've commented on, and a few more as well. So thank you all for listening to Rad Chat. Your hosts today have been myself, Jo McNamara, and my colleague, Naaman Jolka Anderson. A huge thank you to our guest, Zoe Merchant. Head over to our YouTube page to see a live recording of the podcast. If you're utilising this podcast for CPD purposes, consider the reflective questions posted along with links to the resources and literature we've discussed, and to receive your accredited CPD certificate, please complete the Google form. So our next guest to feature will be Dr. Catherine Mannix, who will be discussing dying and death in a really special edition podcast, especially considering she'll be doing the podcast as part of Dying Matters Week. So thank you all for listening, and take care. Thank you.